love you like that. Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.
Good evening to my viewing audience. I am Shavani Nisbet, your health educator from the Health Promotion Unit. On this week's edition of Health Matters, I am accompanied by Mrs. Lee Paris Cambridge. As we may all know, the month of October is celebrated as Breast Cancer Awareness Month. Lee is the founder, executive director, and awareness coordinator of Pink Lily Cancer Care. So this evening, Lee and I will have a small discussion about Pink Lily and what they will be doing in Nevis this month. So Lee, good evening.
Good evening.
Thank you for being here.
Oh, thank you for inviting me.
Could you tell us a little bit about Pink Lily and what it's all about? Anything?
Well, Pink Lily is a cancer awareness and support organisation. And I don't know if you noticed that I didn't say breast cancer.
Right.
Okay, we are all cancer awareness and all cancer support. And we support people in St Kitts and Nevis.
Okay.
All right.
Okay. And when was it started?
We launched Pink Lily on February the 9th, 2008. Mm-hmm. However, I started to raise awareness of breast cancer back in 2007 when I was actually diagnosed with cancer.
Okay. Okay. And is there a particular theme for this year?
This month we have a campaign called Knock Out Cancer, Know the Signs. And that is basically highlighting the signs and symptoms of several different types of cancer that can affect men, women and children.
Okay, good. And how many countries is Pink Lily active in right now?
Nevis is our headquarters.
Okay.
However, I've had inquiries from Anguilla and St Vincent that they would actually like Pink Lily over there. So, but currently we're in Nevis, and also the UK. I go around the UK targeting those areas where there's Nevisions and Petitions, Leeds, Leicester, so the St Kitts and Nevis associations in the UK. I actually go out and I visit with them.
Okay. So you have a good participation rate, you would say?
Yeah, it's definitely increasing. You know, like with anything,
right.
It takes time for you to reach all of those different people, and as volunteers, you have limited time. Sure. And so it's just me in England, so I've been travelling, to those different areas, and I get contacted from people who are originally from here,
okay.
And then they obviously hear about the organisation. I get invited to different organisations' events. And this is what's really, I'm happy when that happens because it's raising our profile and I'm raising money I'm telling people, you are benefiting from the NHS in the UK. We need to support our family members and our loved ones back home in St Kitts and Nevis. Mm-hmm. We could raise a lot of money in the UK. There's so many more financial resources.
Right.
And so I go out and I appeal for things like that.
Okay, that's good. So tell us a little bit about, so I know you're not a doctor, but you know a little bit about cancer. So tell us a little bit about your theme for this year, Knock Out Cancer, some of the signs, what is cancer and that kind of thing.
Yeah, well, we're currently doing a presentation, okay. And it's approximately between half an hour and 45 minutes, depending on how many questions we get from our audience. Okay. And what it does is, well, first of all, we identify what cancer is, because a lot of people don't know what cancer is. They just hear it's a disease, sure. But they don't know how it happens, if anything's connected to it, what are there, is there something we're doing wrong? Mm-hmm. Is it something that we're eating? They have no idea, how cancer develops. Mm-hmm. And so we raise the awareness of what cancer actually is. Mm-hmm. And that's by, first of all, identifying that we have billions of cells that make up our entire body and all of our organs. And cancer is when the cells always, replenish themselves in an orderly fashion. And so when those cells become uncontrollable and they grow at an uncontrollable rate, then when they're normal, they kind of like lay out like a nice, neat building blocks, like a brick wall. But when it goes fast, mm-hmm. Just imagine those bricks coming down. They come down in a clump, and then that forms a tumour. Okay. So and that's how cancer develops, and so it's in the cells, and if one of those cells then comes out of the base membrane, it can then go into the bloodstream, lymphatic system, and spread around the body to different organs, and then the cancer can spread to several different places.
Okay. And what are some of the early signs of cancer?
Well, generally, it's how you can't differentiate the signs generally, because you have breast cancer has breast cancer signs, and then there's different signs for if you have lung cancer. So, but generally lumps anywhere on the body, so it's not just the breasts. So for men, you may feel lumps in their testicles, or if you just feel a lump anywhere in your body, you should always get it checked out by the doctor. Things like abnormal bleeding. And for ladies, that would be abnormal bleeding in the middle of their cycle. So if they've already had their monthly cycle, and then 2 weeks later or 3 weeks later they have another a period, then but that's not on their due day, then that's considered to be abnormal. All right, and again with ladies who are no longer menstruating, if all of a sudden they're bleeding, then this isn't normal. Things like if you're coughing and you cough up phlegm and you see blood in your phlegm, then this is not normal. In your stool, so when you're passing your stool, if there's blood in your stool, again, this is not normal. So any time that you're bleeding, other than obviously when you fall over and you cut yourself, any blood is not a normal thing.
Sure.
All right, other than in our veins and our arteries. The other signs would be, for instance, if you have a mole. If you discover a new mole and you see that it's growing, it's not in a nice circle, it's starting to get itchy, bleeding and scratchy, this could be a sign of skin cancer, and that's a melanoma. All right, and again, we're in a hot country. The darker the skin you have, you may not be as affected, because obviously we're accustomed to the skin, but that doesn't mean that we wouldn't get a mole.
Right.
So you find that obviously a lot of Caucasian people who love to sunbathe, they're very high risk, because of course they're exposed to sun and they burn. And I used to do that years ago, but it's not good to do. So that's with the skin cancer. There's what else? We have the lung cancer. Again, that's with the coughing up of the blood, and also that could be associated with cancer of the esophagus, which is the throat.
Right.
So there's different things like that. So there are a number of signs to potential signs and symptoms of cancer. It's saying that these are signs and symptoms, but not every sign and symptom will turn out to be cancer. But you should always report any abnormalities to your doctor.
Yeah, because the more awareness is, the faster you kill.
Absolutely.
Yeah.
Absolutely. And also we have unexplained significant weight loss. So if you're not dieting and you're not exercising, and all of a sudden you realise that in a space of a few months that you're losing a lot of weight, and you're not doing anything to lose weight, then this is a sign that something's not quite right, and that could be a sign of cancer. And so again, you should check that out. We have these booklets that we're distributing during all of our talks. That's like coughing. Have you been coughing for 3 weeks? Tell your doctor. So even something like a cough, and that's called like persistent. So if something is continuing for a long time, this is persistent. So if you've got a general cold and you cough, your cold, it normally goes after a little while with honey and lemon and stuff. But if something is persistent, it's lasting 3 weeks, 6 weeks. Anything that's lasting 3 weeks or 6 weeks, you should go and get it checked out, because that is not right. We've got bowel cancer, so we're distributing all these. Any worries about ovarian cancer, bowel cancer? We've got the breast cancer, and there are several signs for breast cancer. It's not just a lump. It could be discoloration of the skin. It could be inverted nipple, discharge from the nipple. See, there's a lot of signs, so it's not just one sign. I had a lump. My mum had discoloration of her skin.
Wow.
You see, so there are more signs. We have understanding testicular cancer. Okay, a lot of our young men need to be aware of that. Prostate cancer. For prostate cancer, the signs with that would be if they notice any changes in their passing water. They might have difficulty passing water. They might be passing water more frequently. So any kind of changes passing water, they should go and get that checked out. So that's one of the signs and symptoms. And again, it doesn't mean that they're always going to be cancer, but they're signs and symptoms that they need to look out for. Again, we've got the colon cancer, and so they're encouraged that if they see any blood that they need to get, or even with the colon cancer, if they've passed their stool and still feel that there's something
Urge,
in there. That not even an urge, because obviously if you've got an urge, it's sometimes you can push it out. But it's like feeling that this, you know, you haven't emptied your bowels properly. Then that can be a sign that something's not quite right. So there are a number of signs and symptoms, and again we're handing out this booklet, which is the signs and symptoms of cancer, what to be aware of. So we have loads of literature, and the company who sends these to us we are Macmillan Cancer Support, and they're a UK cancer organisation. They support Pink Lily. They send us, I put my order in for all the different books I want, and they send them to me, and it's like boxes load. When I ordered them, my living room was like a warehouse, and they generously donate them free of charge, and then I was able to then ship them over here in barrels. So it's all about, you know, getting as much information as we can, and if it's free, all the better.
Yes, more awareness. We're creating awareness around the island for cancer and early cancer detection, because that's how you can prevent death, right? And
early detection saves lives.
Yep.
Yeah, absolutely.
And so what are some of the things you guys are doing this month while you're in Nevis for Pink Lily, for Cancer Awareness Month? Well,
we have two main events this month. Okay. We have the event of the year, which is increasingly popular. So this is our 6 years of Pink Lily, and actually our 7th walkathon. Okay. And last year we had an increase every year we've had an increase in numbers, and so last year was 400 people, and we're looking for 500 walkers minimum this year. Good. So it's wonderful to see. So that's on the 18th of October, 6 a.m. from the usual Chickenstone, going down to Sunshines from the Island Main Road, Samuel Hunkins Drive, Old Hospital Road, and then onto the beach. And so that's our main event for that, and the registration is on the 14th and the 17th, which is Tuesday and Friday of next week, and that's in Memorial Square from 10 a.m. till 5 p.m. And the registration is 45 for adults and 35 for children.
And tell us what you get when you register.
You get a lovely T-shirt with our message of cancer awareness on there and all the signs and symptoms. So there's no excuse that you'll forget what signs and symptoms are, because it's on the T-shirt.
And it's pink.
And it's actually green this year.
Oh, really?
Yes, because the Pink Lily we have 5 colours.
Oh, okay, I didn't know that.
So we have the hot pink, like I'm wearing now.
Right.
We have the lime green. We have black, white, and grey. Grey is a new colour that we've introduced because that represents all cancers, the grey area. And so anything that we design will always have all the Pink Lily colours on it.
Okay.
And so we decided to go with the green T-shirt this time, and with all the text being in all the different colours, so they stand out nice. And we have bandanas as well this year. And so they are grey with a black message, and all the signs and the symptoms are on the bandana. Delicious breakfast, as always, and a free entry into our raffle. And so some lovely raffle prizes.
Okay, and tell them about the wig. The wigs.
The wigs! Yes, we are, because we're a fundraiser, and so we have to, unfortunately this year we haven't had a major sponsor, so we've had to actually purchase the T-shirts and the bandanas and obviously the cost of the breakfast from our own funds, so we have to recoup those funds back, and so this is why we've actually had an increase in our registration this year, because of course it's to cover the cost of the T-shirts, and there's a very, very small margin of making any fund, raise funds for that. So I've bought some pink wigs so that we can sell them to generate a little bit more income. However, saying that we haven't had a major sponsor, we've had people partnering with organisations and people partnering with us, giving us sponsors, contributions towards our breakfast, our awareness material. So we have a list. We've got Delia Walwyn, who have been they're actually our silver sponsor, and that's to help with all of our awareness and promotional material. We've had 2 bronze sponsors, Four Seasons Resort Nevis and the Bank of Nevis, and that helps towards our administration, communication and printing, because every talk that we do and every and printing of posters, and we're giving out a lot of literature, but we have to produce that ourselves, and all of this costs money.
Right.
And then we've got what we call our pink sponsors, and that's for all other types of financial contributions and prizes, and help with breakfast and fruit and so on. And so we've had National Bank, RBTT, Rams, Brown Hill Communication, Zone Auto, Strikers, Sunshines, it's the venue that we're having breakfast at, Tropical Ice, we need ice, Jamaican Bakery, we need bread for breakfast. So excuse me, Office Machines Limited, Stephen Hector for the tents, Bridget Hunkins for the tables and the chairs, even things like that, we need them. TDC, Horsfords, Nevis Cooperative Credit Union. So far, they have been our contributors and sponsors. And we're still looking for more, so it's not too late to make a contribution, no matter how small or how large.
True. And other than the walkathon, what's the other event?
The other, well, I say active, they're actually activities, that's actually going around the island, and we're doing talks in workplaces, churches, schools, and through community development. I'm actually going into different villages, and I'm in Rawlins Village, which is the village I'm from, next week. And I stress that Pink Lily's been running for 6 years, and I have never done a presentation in Rawlins. And I was like, this is my village. And I was telling my sister Tracy, who's been coordinating that, I said, I need to be in Rawlins. How can I be all around the island and not be in my own village?
Sure.
And so we're in Rawlins Village next year. So all of that will be on community calendar. And I urge the general public to come out to them. So if their workplace isn't having a talk, and so they haven't got anywhere to go to see the presentation, they can go to the villages where the community development have organised the talks.
And these talks are the same Know Your Sign talks, right?
They're Know Your Sign, Knockout Cancer, Know Your Signs, which you were privy to yesterday.
And it was good. It was very informative.
Yeah.
Right. And do you know do you know off the top of your head the different venues you're going to be, like, next week you're going to be in Rawlins, where you're going to be in?
I'm going to be in Brownhill, Prospect.
Right.
Brownhill will cover Prospect as well. Newcastle area. There's Brownhill, Rawlins, Barnsgut.
Okay.
So they're the ones so far that I'm in, which is for the community.
Okay.
So that's four that we're in the community, and it's not too late to book a talk.
That's true.
So we're doing morning, afternoon, and evening talks. All the 7 p.m.s are gone, but then there's still 5 o'clock talks, and then there's the morning and afternoon talks. So please do not miss out on this opportunity. You'll get to see me for the next few days, and after that it will be the Pink Lily volunteers who will be delivering the talk. So if you want a little bit of my craziness, then you need to come out now.
Good crazy.
Good crazy.
And you find that your participation on the island in terms of people coming out is getting better every year. Right?
Oh my gosh.
You were saying the walks get better every year,
Most
but also
definitely.
Talks as well.
Yeah, this is the first time that I've done a talk that is general with all the cancers, but we've done different talks in different places. We did, there was the other year, I did 44 talks island-wide, and that was in 1 month.
Awesome.
And so I would like to do as many this time round as possible. So so this is the second time we've done an island-wide, and we also went to St Kitts as well, which we're going to St Kitts for these talks as well.
And in terms of feedback, you find that people are learning a lot from what you're saying. They're understanding a little bit more about cancer, which is your purpose, right?
Most definitely. People stop me in the supermarket in town, and then even after the talks, they stop me and talk to me after we've done the presentation to share their personal stuff with me, or just to ask questions. And as you saw yesterday, I designed the programs to be interactive, and so we had a little quiz yesterday, and so everyone's going to have the quiz, and so that engages my audience, and then it also helps me to assess how much knowledge they have about the awareness. And I've been very surprised. I'm like, you're going to make me redundant, because everyone's like giving the right answers.
Yes.
And I'm saying, this is good news.
Yes.
Because it's making you think that, is it A, B, or C? Is it true or false? And so, but no, it's really good that it's done in a kind of light way. We're talking about a serious message and just bring it in a light way, because it can be quite daunting.
It is.
And I don't want to make people to be afraid.
Yeah, especially for people who actually have family members who've been through cancer. It kind of brings back memories sometimes.
Yeah,
so you kind of want to bring it from an angle where the interest will be piqued. At the same time, they know there's life after cancer.
Absolutely.
Yeah, so that's good. And just a little question. When one says a cancer is in remission, what does that mean? Explain a little bit about that.
That means that once they've gone through all of their treatment, and then there's a time frame, and it's usually 5 years. So that means they've completed all their treatment, and 5 years once they've been checked by their doctors, and they've had all the examinations, that there is no traces of the cancer.
Okay.
And so then they're considered to be all clear.
Okay, and clear for life, or they have to still get checked every 5 years?
They need to get checked, because cancer can come back.
Okay.
So just because you're in remission, thank God you're in remission and your cancer clear, cancer can always come back. And so we should never think that because we've had it once, it will never come back. Because in my support group in the UK, this one gentleman had cancer come back 3 times in different places.
Wow.
And so, you know, it doesn't discriminate just because you've had it once before. It doesn't discriminate against age, sex, how much money you earn, what party you vote for, what church you go to. It does not discriminate. So it can come back at any time, yeah.
That's good. Okay. And are there any last words it could be last words of advice to current cancer fighters, past cancer fighters? You want to give any words of advice to the public?
Well, I'd like to say that cancer is no longer a death sentence as it was once known to be, and some of that was due to the fact is that we just weren't aware. There was no awareness about that around there. There was also the fear surrounding it, so people would never talk about it. So I encourage people to come on out to Pink Lily. We're here for you. Whether you have an inquiry, you just want a bit of information, you are concerned, you're anxious, come to Pink Lily because we're there for you. If you want practical advice, you want emotional support, you want spiritual support, Pink Lily will be there for you. Whether it's you're just inquiring, whether you're actually going through it, or whether you've had somebody who's passed, we are there to support you, to bring you peace, comfort, strength, and help you to go through any journey that you might be going through. Prevention, prevention, prevention. What you eat, how you exercise, the alcohol, the smoking, the stress, all of these are kind of factors. So not only is it, they say in your family history, but there are environmental factors as well. And so like the toxins of a cigarette, lung cancer, being overweight, these are all factors that contribute and raise your risks of getting cancer. So we need to look at the preventative measures, which we will be doing a separate presentation on that, because that's a request that I'm getting quite a lot.
Okay.
Of preventative measures, and after the talks I give out the feedback forms to find out what people thought, what information they need, what talks they'd like us to do in the future, and prevention has been one of those areas that people are asking for.
Okay, that's good. Well, Lee, thank you for being here. Thank you for letting the public know about Pink Lily, giving us some insight about knowing the signs, which are very important. We always should know our signs.
Absolutely.
And so this has been very informative. So I'd like to thank the listening audience for listening and paying attention this evening, and for Lee for being here. Thank you very much.
Knockout
cancer.
Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.